with the National Spine Health Foundation, really looking at the military and veteran community and saying, let's examine what the spine health needs are for this unique population of patients, and let's figure out how to make a difference for that community. I think that's one of the things that we're so grateful to have your expertise and your knowledge and your wisdom to help guide what that looks like. A lot of people have talked with us about just general knowledge about the spine, how it works, how to keep it functional, how to keep it strong. What is bone health as a component of that? There are just so many things that people don't really think about at top of mind. And yet, with the spine condition being the number one reason why people get disabled, education around that seems to be paramount. I guess the question is, how do we do a good job with that, and where are the opportunities?
The blessing and cursing of the internet, right? If it's on the internet, it must be true. So the challenge is not, is there information available? It's, is that information credible, and is it helpful? And so what we hope the National Spine Health Foundation is going to emerge into is a well-recognized conduit for high-quality information that patients can trust. And if that's the case, then accessing and having links and having information that either comes from word of mouth or networking or advertisement or whatever, that the National Spine Health Foundation becomes a recognized brand for excellent, high-quality information.
One of the most important things about the organization is that, what we've seen really through the course of the wars for the last 20 years is that not everyone who's eligible for military healthcare can actually get it at that place. So obviously I'm here in New York City, and the military academy is about an hour away, and to go to Walter Reed is 4 or 5 hours, and it's a couple of days of travel. And so a lot of us will still provide care for people who are active duty military, or certainly retirees or dependents. And it's important that the information in how to care for this population, which is unique and different than what we typically see outside, that all spine surgeons or physical therapists or occupational therapists or rehab physicians or pain management physicians or anyone who really deals with spine health or bone health understand the unique challenges, opportunities, and maybe constraints about this population. So I think that's one of the important things about the organization, is to really get this information disseminated so that there is a repository of information that says, if you're in San Diego and someone from Nebraska who's active duty military comes there and they're on vacation, but they have an injury or an issue, and you're going to take care of that particular person, do you have the understanding and information about what they do for a vocation? We call it military occupational specialty, MOS, and that's going to be unique and different than someone who is, works in an office. And so I think that information also is important, really, from that, bi-directional approach, because it's a different population.
Yeah, that's amazing. To be able to create a recognized, trusted resource at your fingertips for both the provider and for the patient. I think that's going to be amazing. And I never thought about it that way. I think creating a community of spine patients in the military, and maybe we need to do it by service division. Maybe it's different for Air Force than it is for Navy, than it is for...
It's very different for the Air Force than it is for the Army and the Marines. No, there's a lot of really great inter-service rivalry. There's a football game coming up in about a week that may speak to that, but that rivalry exists for that day, and then we're all on the same team. But the needs and the way that all of us worked in the military was, you asked the person who had gone before, how did you deal with this situation? How do you make that work? And that we got that information from our predecessors. And so that's part of, I think, what we feel is the desire to give back to our successors about what are opportunities and how might you succeed in that. And I think that you're absolutely right that the cohort of like individuals in like circumstances really speaks volumes to the individual compared to what I would say to them as a surgeon. And Ron and I, both having been surgeons but also having been patients, also affects our thinking about it. And so learning from peers or near peers about what it is to expect and what the time course for recovery is something that is incredibly helpful. And I think you can say that same thing.
Finding someone similar to you that's had a similar, condition. What was their journey like? How do I learn from that? And how do I get hope in their recovery? That is one of the most powerful things I think that we do here, that you help us do, with sharing your knowledge, sharing your patients with us, and us putting the patient stories out there. That sort of testimonial is so important. And being able to carve it out to specific populations, right, I think can be very helpful. Those are unique circumstances. If you're in a tank or you're in a sub or you're in a jet, the ergonomics, as you say, are different, and they present different challenges and different needs, for sure.